Good morning. Today, being June 14th, is World Blood Donor Day. The international event states that the aim is to raise global awareness of the need for safe blood and blood products for transfusion, and of the critical contribution voluntary unpaid blood donors make to national health systems. It notes further, the day also provides an opportunity to call to action to governments and national health authorities to provide adequate resources and put in place systems and infrastructures to increase the collection of blood from voluntary, unpaid blood donors. We are also in the midst of Pride Month in June, an opportunity to raise awareness of issues and pressing challenges faced by the LGBTQ2+ community and those around the world. There are thousands of gay, bi, and trans men who are willing and ready to safely donate blood. It is time for them to be allowed to do so. So it is World Blood Day and Pride Month. There is no better time than today to make history, end the discrimination and stigma, and end the blood ban for men who have sex with men. I want to acknowledge and congratulate and thank the United Kingdom Conservative government who today have made this historic change, where all donors will be asked the same questions about their sexual behaviors in a gender-neutral manner. Now people in the United Kingdom can donate if they had the same sexual partner for the last 3 months, meaning gay and bisexual men in monogamous relationships can donate for the first time. Our Prime Minister and the Liberal government have promised 6 years ago to do this, and they've failed to keep their word on this serious and solemn commitment. They did not promise to study it. They did not promise to deflect to Canadian Blood Services or Héma-Québec. And I will reiterate this again. If you can make this promise during an election campaign, when you form government, you should have a plan to deliver and get it done. Today, I have introduced a private member's motion in the House of Commons that puts Conservatives' safe, scientific, and reasonable solution that can be implemented safely and immediately. It calls on the Minister of Health to use the regulatory powers that she has under the Food and Drug Act to remove questions based on sexual orientation and instead base the questionnaire on gender-neutral questions of sexual behavior to determine the risk. This safe, easy change continues to protect our blood supply. It is endorsed by the membership of the Canadian Medical Association and the All Blood is Equal campaign. Now, it is important for Canadians to know that before release for transfusion, every single blood donation is tested and must be non-reactive for diseases known to be transmitted by transfusion. The science and technology has evolved significantly over the past years. Yet the issue is a window period that science hasn't perfected yet, when someone is infected with a disease and when it becomes traceable in testing. That is why the list of questions is asked to help reduce risk to our blood supply. There is no question that Canadian Blood Services and Héma-Québec have done a great job in keeping our blood supply safe, as it has been decades without incident. But there's also no question that the gay blood ban is outdated. It is wrong, it is discrimination, and there is a safe solution that can end all of this now. With each passing day, more and more Canadians are learning of these outdated questions and are upset that this blatant type of discrimination still exists in Canada. They are even more disgusted to learn that the Liberals promised to fix this 6 years ago and have yet to do so, especially when they have the regulatory power and they choose not to keep their own promise, and that this discrimination continues. So this World Blood Donor Day, in this Pride Month, let's do something meaningful. The Minister of Health could end this today. Conservatives are calling on her to do just that. No more feel-good statements and virtue signaling. No more court cases where you continue to lose. Keep your promise. Do what you say you would do. Make this Pride Month and World Blood Donor Day one where you did the right thing. It is long past time to end the blood ban in Canada now. I'll now pass it over to my colleague, Michelle Rempel-Garner.
Thank you. I'll just add to my colleagues' comments by saying we do note that the federal government has lost an attempt to block a Canadian Human Rights Commission inquiry into Health Canada's role in this policy. Given this ruling that happened last week, given that it's World Blood Donor Day, given what my colleague Eric mentioned about the United Kingdom's government, it is long past time for the government to act on this. There's no reason why they can't, and we will continue to escalate this issue in the House of Commons until there is a solution. It shouldn't have to take this amount of effort. The Minister of Health should have provided a solution a long time ago. Thank you.
And we'll now take questions, starting with questions on the phone. As usual, one question, one follow-up per reporter. Nous allons maintenant passer aux questions, commençant par les questions au téléphone. Comme à l'habitude, une question suivie par journaliste. Operator, do we have a first question?
Thank you. Please press star 1 if you have a question. Veuillez appuyer sur étoile 1 pour poser une question. Our first question is from Rachel Ayello from CTV News. Please go ahead. À vous la parole.
Hi, thank you. Mr. Duncan, I understand you've put forward this private member's motion, but I'm just looking to get a sense of where you stand on the order of precedence and whether this is actually a topic that is feasible and possible that you're going to be able to bring up in the remaining few days of this session.
Morning. Thanks, Rachel. Unfortunately, my number is later on. I have a number currently right now, and I've already introduced another piece, but this is something we wanted to get on the record as a solution that Conservatives are proposing. We want to put the pressure on the government, on Liberal MPs, hopefully take this up and, put the solution on the table. There is actually, it doesn't even require this motion to pass. The Minister of Health today can go and do this. Conservatives, we wanted to be on record for this, and that's why we're tabling this private member's motion to put the clear solution on there. And again, this doesn't need to pass itself. The Minister of Health can enact the section we're referring to and actually take the leadership herself. This is about raising awareness as well about the tools that are there. The government says, oh, we can't do it. We need to defer to Canadian Blood Services or HEMA Quebec. That is absolutely false. We're putting on the record the solution that can end this today.
Thank you. And to follow up, it's a question for both of you. I'm just wanting to get your comments on the record about you have been advocating for LGBT rights this month and previously, but you have other colleagues in your caucus who have recently come out and in some ways, at least in the House, fought against the conversion therapy bill and have had other things that seemingly were positive about conversion therapy. I'm hoping if you feel, or I hope you can both comment on whether you feel this undermines the message from you and from Erin O'Toole with a video marking Pride Month. Like it's unclear where exactly the caucus stands. It seems like there's some division. I'm hoping to just kind of get your thoughts on where things stand within the party and LGBTQ rights at this moment.
Thanks, Rachel. I've been very clear and I'm very fortunate to be able to have a voice and to raise issues if it is on conversion therapy. And I've been on record of supporting the legislation, which I will do. But my voice gives me the opportunity to do exactly this today, to be out talking about the discriminatory blood ban, proposing solutions, and not just during Pride Month, but Michelle's been absolutely wonderful to work with as well through Health Committee and through other avenues as well of raising awareness and raising these issues. I've been fortunate to be able to do that. I've been very welcomed, and our leader's been on the record supporting numerous of these initiatives as well. So again, I feel that I've been able to be a very strong voice in these issues, to do my thing and to say what I need to do. I've been proud to have some wonderful support, including from our leader.
Thank you. I'll just be very clear and I'll state the party's position. Conversion therapy is a human rights abuse, and our party leader has been very clear that he opposes that practice. He is supporting the legislation that is in front of the House, as is a significant amount of our caucus. Thank you.
Opératrice, prochaine question.
We have no further questions registered at this time. Back to you. Nous n'avons plus de questions pour le moment. De retour au plancher.
Right, I'll check if we have a question in the room. Well, this concludes the press conference. Thank you very much.